Good afternoon, everyone. The time is now 4:08. I call to order the meeting of the Health and Mental Health Committee. A copy of the agenda for this meeting may be found on the county website under the tab for the legislature. Please silence your phones and electronic devices. And at this time, I ask you all to please rise for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Doreen, could you do the roll call?
Absolutely. Emo.
Sure.
Anagnostakis.
Present.
Eller.
Here.
Luhan. Sutherland. Here. Hotel. Here. Tui.
Here.
6 present, 1 absent.
Okay, thank you, Doreen. First up on the agenda, we have Darcy Miller, Commissioner of Social Services and Mental Health. Darcy, if you join us again, please. Okay, first up here, Darcy, we had item 1A. It's a request to accept and appropriate New York State Office of Mental Health, WOGI, Welcome Orange Geriatric Initiative Grant COLA increase for year 2 in the amount of $16,200. Additionally, appropriate unused year 1 2022 funding in the amount of $20,000 into the Department of Mental Health's 2023 budget, $36,200. This is legislative request number 154. May I get a motion?
Second.
Sutherland. Okay, Commissioner.
Okay, so very simply, as stated, in a Welcome Orange Geriatric Initiative is a partnership between our departments as well as contracts with our community agencies, takes services right into the home of those who struggle to get out of their home, in the elderly population, to provide them with mental health, substance abuse support, and any ancillary needs they may have. So really led by Lacey Trimble in our office. It's a grant-funded program, and we appreciate the COLA increase as it will help us to retain staff that support this program and this population.
Any questions or comments? Ready? Not seeing any. I called the question. All in favor? Aye. Opposed? Not hearing any. Motion carried. And Commissioner monthly update, item B.
So last week, Governor Hochul held a summit down at the Javits Center, and we did have our deputy and our director of children's services attend. There were a number of presenters there. It was really a call to action to meet the mental health needs of youth across the state, and in particular in the Hudson Valley. And we are working diligently, not only out of our department, but also with our community providers. And we successfully opened the satellite in the Monroe Woodbury School District, and Goshen is next. It's one of the movements in that direction. 311 Text for Teens is available to our youth across Orange County 24/7. And we hope that any parents and or youth are struggling to get service, that reach out. This is citing the National Association of Counties, who collected a presentation for about a year ago on our crisis continuum and our interoperability with 911, 311 co-location at the Emergency Operations Center. They called and we spoke with them about 2 months ago. They have a partnership grant funding with RAND, who they've selected 3 sites across the country that they want to use as pilot projects, best practice interventions. So they're coming in, they're doing a full research of our planning and our partnerships and our spending, and they will come and do a site visit of our location, really to be able to write up a paper that will be shared nationally for others to consider emulating our model here in Orange County.
Congratulations are in order.
So that's pretty exciting,
Yes,
right?
very good.
For all of, many involved in that effort, and Brendan Casey and I are very proud to be leadership of the department that made that happen.
Okay, great.
Deputy Commissioner, Lacey has been selected to be co-chair in New York State Substance Abuse Mental Health Work Group for Master Planning on Aging. really appreciate the focus on our aging population as we all are moving in that direction. But also, because, as Emery talks so often about the isolation for this population and, that isolation really leading to potential mental health issues, increased substance use issues, the loneliness, being overwhelming. Appreciate the attention that's going to that population to really try to support them and get excited about some of the other things Emery talks about, right? Like senior day and trips and all of that. So I'm glad to have Lacey representing Orange County on that committee. Our local service plan, which is an integrated plan between Office of People with Developmental Disabilities, OASIS and OMH. We have completed that plan. It's gone to our Community Services Board and will be submitted, covers in a large category the major issues across Orange County that we're looking to address, housing, access to mental health services, reducing opioid death, and along those areas. So we're very pleased to have that completed and ready to go in. We've talked to you about the Healing Community Study, which is the NIDA funded program in partnership with Columbia. NIDA, the federal representatives, will be coming to Orange County on June 27th. We have selected some of our partners in the work around addressing the opioid epidemic and the issues connected to it. They will come to the Department of Mental Health and we will take them to our partner sites, and they will get an opportunity to learn more about Orange County, what we're doing here, and to support our efforts in Orange County. I think you're all familiar with the Think Differently movement. County Executive has initiated, and our Department of Mental Health has taken over co-leadership of the Think Differently. It's a very good match with Christine Smallin, who is the director of our Developmental Disability Services. And she and one of our consultants are just doing a fabulous job working side by side with Mary Pat, extending that messaging. The Light It Up Blue fundraiser, which raised almost $18,000. Isn't that wonderful? $18,000. I believe a good portion of it is going to honor to support their sensory room, probably the only family and adult shelter across the state that will have a sensory room. He acknowledges so many of the children there have been so traumatized by their experiences and the unknown of not being in a stable place to live even, that some of it looks like a spectrum, like someone who might have autism. It's probably a combination of both trauma and some who may have autism. But this room is just a place where they can go and it's sensitized to a multitude of needs. If you need sensory deprivation, you can go in the tent. If you need sensory connection, you can climb the rock wall. So it's pretty exciting that he's doing that, and we can support that with the fundraising. And that is it. Oh no, I mentioned, I did mention, which you all just heard in the last committee, but this is the Honor SOS teams. So you are familiar with that funding that came in. It will be funded directly to Honor. We'll work very close partnership with the Departments of Mental Health and Social Services. They'll have a second team in Dutchess County, and each of them, I'm sure, will have the uniqueness based on the county. But Chris Molinelli and his team will do a fabulous job with those funds and with this team.
Okay, and you had the rest about everybody sharing their
Just sharing
social media.
information. Yeah, just keep putting the messages out.
Getting it out.
Yes.
Great. All right, does anybody have any questions for Commissioner Miller? Comments or anything? No? Okay,
Thank you.
great, thank
Have
you
a good
very much.
afternoon, everyone.
Okay, next up, we have item number 2. Lawrence Ledoux, Commissioner, Valley View Center, and Donna Strecker, Director of Finance, Valley View Center. Welcome.
Good afternoon, everybody.
Hello.
Hello.
All right, we'll go right into the monthly financials. No requests this month.
So the results we're reviewing are
for May 2023, reconciled to the general ledger as of 6/12. After publishing this, we noticed there's a typo in the footnote that May 11, 2023 marked the end of the COVID public health emergency. It was a milestone to actually get the opportunity to update this financial report. That information, we apologize for the health being misspelled. IGT funding, we budgeted 7,000. We haven't received any IGT funding. We do not,
7 million.
7 million. We do not have any new information on IGT at this time. We continue to follow up with Leading Age. Lawrence has been following up with the Department of Health. So stay tuned. We'll keep you posted.
When was the last time we got?
The last one we got was in 2022, and it was for January.
That was last year.
That's the last payment, though.
Is it?
Yeah, that's the last payment. We haven't gotten any for this year.
Thanks.
Oh, for this
Yeah,
year,
for
right,
this
right,
year,
right,
yeah.
sorry, I'm thinking.
Yeah, no
Yep.
problem. Public nursing home revenues coming in at 14 million, personal services coming in just below 8 million. Equipment, we've purchased 32,343. We have earmarked for expense another 27,000 on the contractual side. We've spent 3.4 million. We have 2.7 million earmarked for expenditure. Employee benefits coming in at 7,305,000. And a small amount of serial bond debt, 36,764.
Okay, so now you're looking at 2022, so they still owe 4,781,421.
Correct.
That's the amount you're waiting on.
Mhm.
And is that, is that common that I know like a few years ago when I first got in, they owed the Valley View for years. And is this, I thought they had kind of gotten themselves up to date somewhat and now they're slipping back again?
You are correct. They were very timely on their payments, so we have not seen this type of delay in quite a while.
It's been a couple of years, at
Yeah,
least.
probably five.
Yeah.
It's been a while.
Yeah.
Yeah,
It has been a while. I know that there are talks between CMS and the feds, and we're waiting for them to approve the upper payment
They
limit.
don't say anything, give any reason.
they don't give us any
They
specific
don't give us
details.
any Details.
Okay, thanks.
You're
Yep.
welcome.
See, the census is slipping some more.
Well, yeah, in May, our census was 61.96, but we are trending upwards, Lawrence.
So, yeah, for the month of June, we're up, year to date, or monthly for the month of June, we're at 63.49%. So we are trending in the right direction. If you remember back in April or May this year, we still had COVID affecting us quite negatively. So we had no COVID cases. We are admitting short-term residents, and census is slowly ticking up.
Hope that
Trend
trend
continues,
continues.
absolutely.
Yes. And hopefully that was making a turn there. Okay,
And if we turn to, or look at the analysis of billed days, Lawrence and I were looking at this before the meeting. If you look at our Medicaid population, you can see in May, our utilization there is 75.17. Then you have a small amount of HMO, Medicaid HMO, 1.43. The Medicare, though, we've been able to grow that census, which is very positive for us because of the higher reimbursements. So 13.38, which is actually above last year. So it's a positive at this point that we have 26 people on our short-term rehab unit right now. We still need to hire more staff. Lawrence is going to talk a little bit about progress we're making on staff. We would like to open up another short-term rehab unit, but we're still facing the obstacle of hiring staff for that unit.
it's encouraging.
It
Any
is.
questions? Legislator Anagostakis.
And also the private pay is up like 1.4%. That's good too.
Yes,
Yes.
yes,
That
yes.
adds to the Medicare, which is up. Those are good trends. If we can
They
get the
are.
census up. The only thing I wanted to comment a little, trend moving up on the workers' comp, going up to 125,000 year over year, and now 150,000 year over year, which based on it being one and a quarter million last year, it's like a 12% increase. And if, remind me if I'm wrong here, a few years back, we had that down like to $1 million.
Yeah, not a million, and actually, I think in the 2024 budget, it's decreased. When we're getting ready to do our 2024 budget, the ID that gets passed to us is gonna be less than 1.4, so it's gonna go down again. But now, not down, I don't believe about
4
it.
years ago or so, over a million, 1 million, somewhere around
You
there.
thinking 1.1 million, that's what's coming to my mind, but I'd have to look back. and let
But
you know.
here's my point is, what's a little concerning to me is that it's up 150,000, up the 12%. Our census is down 30% from 90s to 60. So we have
Correct.
less work,
Right,
Correct.
more workers' comp, and I wanted, maybe you could address why that's occurring, because we've got the right equipment here in the last 8 years or so to cut down on that workers' comp. So why the?
Yeah, I didn't bring anything to speak to that today, but we could certainly look into that,
yeah,
you know.
It's a trend that would be counter to what I would expect.
Right, correct, you're
Yeah.
right,
so we
And it's
can,
a trend I wouldn't want to see continue to go that way.
exactly.
we can talk about it and we'll gather some facts. for you.
Okay, perfect, thank you.
You're welcome.
Okay. Donna, thank you. And Lawrence, you want to go into the
Sure.
update?
Sent out my monthly update. The census the other day was 62.78%. Today's census is 63.61%. We still have 3 units closed due to staffing issues. We are admitting short-term rehab residents. I included the attendance incentive results from week 5 through week 10. You can see we're averaging, around in the 60s. And about 40%, a little over 40% of our nursing staff have been eligible for the attendance incentive. The CHA has a census of 14 currently. In May, should have put the month of May here, sorry. That's another typo. In the month of May, the CHA had 10 new admits. I did put that 9 discharges and conducted 230 therapy treatment sessions in May. We are struggling to hire home health aides. We could be working with a staffing agency, see if we can get some assistance on that. We had no COVID positive residents or staff. It's been a busy couple of weeks at the nursing home. We had the New York State Department of Health on site for our nursing home Medicare recertification survey from June 1st to June 8th. And then the following week, we had the New York State Department of Health on site again for our CHA Medicare recertification survey, and that was for 3 days from June 12th to June 14th. We are still awaiting official survey results. We will receive some minor deficiencies on both surveys, which is normal, and the survey results will be shared at next month's meeting. As Donna mentioned, we don't have any updates on the IGT info. I'll just give you some information as well regarding the staffing or hiring, I should say. So from April 1st, 2023, we have received 20 applications for LPNs and RNs. Of those 20 applications, 4 were not even licensed. 6 of those applicants we attempted to contact repeatedly, but we did not get any response. One of those applicants declined one of the positions for salary reasons. We had one per diem LPN that was decided that they weren't interested. There was no specific reason given. We did hire 4 of those applicants. One was a full-time LPN. However, she did quit after 2 weeks. It had nothing to do with Valley View or anything to do with the job. It was personal issues. We hired 2 per diem LPNs that are still employed, and with 1 per diem nurse care supervisor that initially declined due to salary, then accepted the position, but has delayed the start date to the end of this month. So we're not sure if she's going to come on at all. We're still pending. We're still working on hiring 2 other nurses. One's a full-time LPN, one's a per diem LPN. So we're trying to close out 2 of those. For CNAs, from April 1st, we received 32 applications. Of those, 10 of those applicants were not even licensed. One of those applicants, their certifications expired. 6 of those we attempted to contact repeatedly, but did not get any response. We had 6 interviews scheduled for these applicants, and 6 of those people were no shows for interviews. 4 of them were not interested. Reasons varied, not available during weekends, during school, so on and so forth. 1 was a previous employee that was terminated, so we would not rehire them. And out of those 32 positions, we hired 4 those CNAs, and all were full-time positions. The good news here is that we are getting more applicants. The bad news is you can see the actual hiring rate, it's pretty low.
And where have
So-
you been getting your prospects from?
Mostly Indeed. We pay for advertising on
Seems like you
Indeed.
got more, getting a little more.
Yeah, the applicants are coming, the applications are coming in a little faster than they were previously, but as you can see, it's very difficult to go through the whole
Hopefully
hiring
that will
process.
kind of keep going with the trending.
Exactly.
Get some, keep getting traction and getting
Hope so.
higher quality.
Hope so.
Okay, great. Legislator Sutherland.
Are you getting any applicants from any of the job fairs or anything with the counties too? Or is it mostly Indeed?
I don't think we got any nursing applications, but I think we did get an application for one of the maintenance positions that was open. So, it's not a total, and I think we may have hired 1 or 2 people in the kitchen from the job fair, so, yeah.
Legislator Amo.
Was, we talk about the CNAs, do we still have a training program?
No, we don't have a training program in-house.
We used to. Maybe,
Not since I've been there. I've been there 10 years now, so it might have been a long time ago.
why wouldn't we have it? I mean, it's not that big.
Honestly, I don't think we have the resources to do it right now. Yeah,
Let's suspect our competitors have.
I'm not sure. There aren't too many places you can get your CNA license.
Okay.
Yeah,
Okay. Hold on. I'm trying to think, grow your own.
yeah, no, I agree with you, but, yeah,
And Hawk doesn't offer that?
I forget who offers it, because I have,
It's BOCES.
I think it's BOCES, and I think there's a
BOCES.
private company that does it as well in Orange County. Yeah,
It's still 2 years though, and they have to have, I think it's 16 hours of clinical and it's a lot less strenuous than like, the other programs in,
Right.
in the nursing program, but
I don't think it's 2 years, I think it's shorter than 2 years for CNA.
Well,
I
you
think
have to have like your first year of like your basic stuff, and then your second year is when you do the
Oh,
hands-on.
okay, all right,
So yes, it's not
right,
full 2 years doing
Right.
that, it's just the 1 year, but
Right.
the first year, their junior year is
right.
the basic stuff. Learning.
Great. Well, this was a nice report to hear today. At least it sounds like we made the turn, and I'm not.
As long as it just keeps trending in that direction, so.
Okay, I'm gonna take another question from Legislator
Thank
Stackis.
Yeah, I just want to touch a point upon the last point that you made on the report, and actually was touched upon by the chairman before, that the IGT is not going to be accruing for the audit period. That's kind of the way it was back in the 14 to 16, 2014, 15, 16 time period. Some years we wouldn't get the payment accrue in time for the audit to be, when the audit was complete. And then we double up the payment the following year. So what's going to end up happening is, since it's not accruing for this year, we're going to show that we're going to be extra in the red this year, above and beyond what we've been since COVID. It's going to look really bad. And then next year, if they double up, which they probably will, it'll all of a sudden look like a miracle that we've closed the gap to almost zero again, which won't be the case. It's just a doubling up of payments. So I just wanted to point that.
I remember correctly in 18 and 19, the 2 payments said they were catching up with like over $13 million.
Yeah, they will, yeah. So, and we're in the same
It's
position, so.
a good point.
So just for everyone to have the heads up, it's gonna look really bad this year, and it's gonna look
For
really
22,
good next
yeah, for
year.
22, yeah.
Yes, and it's not, it's just kind of bad.
It's just, it's a wash, but
Yeah.
yeah.
Don't forget to remind us that at budget time.
Well, we'll remind you as soon as it comes out, and Mike will remind everybody too.
Yeah. Because we're not printing any better, we're down like, right, we're down like another $1 million off of what we were last year. So what was the deficit, was like 4 or 5 million? So we're in that ballpark again.
Yeah.
And it's not gonna change unless we get that census up, and I don't see any way to get the census up, so I don't know what's gonna happen.
Well, staffing is the key to
Yeah,
that,
yeah.
right?
So it comes back to the hiring.
I agree.
Yeah.
So,
All right, any other questions from the committee members? No, well, thank you very much.
Thank you.
thank you.
Thanks.
All right, next up, item number 3, we have Dr. Alicia Pointer, Commissioner of the Health Department. Lisa K. Lahif, Deputy Commissioner, Health Department. Welcome.
See you later.
And first up, we have a request supplemental appropriation of year 5 funds into the operating budget for the period of 4/1/2023 through 3/31/2024 from the New York State Department of Health for the tuberculosis prevention and control program in the amount of $39,166. Legislative request number 150. Can I get a motion?
So moved.
Tell Sutherland. Okay,
This is year 5 of a 5-year grant, but we do get this annually. It's our tuberculosis diagnosis and treatment program, which we do in our clinics and at people's homes. It funds a chargeback for one of our employees and mileage.
it was charged back.
Chargeback for one of our employees, for one of our nurses, and mileage,
Okay,
because we're going out to people's homes for some of the treatments.
okay, great. Anybody, any questions? Legislator Tortel.
Does this actually cover the vaccine?
It does not cover vaccine. It covers testing, if they need a chest X-ray, so the quantiferin or PPD, if they need a chest X-ray, and then treatment. This is mostly for people who are uninsured. If people have insurance, we, refer them to their providers for their treatment.
Okay, any other questions? Not hearing any, I'll call the question. All in favor, aye? Any opposed? Not hearing any, motion carries. Thank you. And we'll go on to the monthly update.
I actually wanted to start with something that's not on the updates that I sent you guys, so I apologize. Regarding a medical examiner decedent transport, just so that you are all aware. Currently, our transport is done by the Funeral Directors Association. At the end of 2023, they'll no longer be transporting decedents. So we're looking into other options right now because obviously we need to make sure that people get from wherever they are to the medical examiner's office. This is only for people who need to go to the medical examiner's office, which is a small percentage of deaths in our county. We have a couple options that we're looking at, including doing a request for bids for an outside provider to come in and assist with transports. We're also considering whether we would bring it internally.
And what happened with the funeral directors?
Funeral directors as a whole are aging. There are fewer of them dealing with more complicated issues. And it sounds like it was just a lot for them to take on. And that's to continue to take on.
I got a legislator, Nagastakis, and legislator Ellers.
To follow up, that's what I was gonna ask. So did we have any kind of contract in place with the funeral directors to do this? If so, until when? If so, were they getting paid for that? If so, who terminated that contract?
I'll try to answer them one at a time. There was not a contract in place. They were kindly doing this for us. They were getting paid per transport. The Funeral Directors Association as a group met and decided that the association, which speaks for some of its members, I can't say that they speak for all of their members, would no longer carry this forward. We're grateful that they gave us as much time as they did. They gave us until the end of the year, which is better than other counties have received from their funeral directors, and we're really grateful that they've done it for us for so long. But there was not a contract.
Legislator Ellis.
So my recollection is that it has to do with the payment that the county is offered to pay per transport. What does that fee per?
It's $125 per transport. When they've talked to us, they've said that it does not have to do with cost. That's coming from the Funeral Directors Association. We've met with them. It's really person power and the fact that, as I said, you know, they're getting older and there are fewer of them. You know, I can't speak for them beyond that.
So the $125 fee, when you got out of bed in the middle of the night, get a helper, bring their vehicle to wherever they have to go, transport to the office, doesn't sound reasonable to me.
They've done a
And I
lot for
think that
us.
has a big,
I agree.
big part of it.
They've put a lot of work into this, and that's why we're putting out this request for bid, because there may be people who are still willing to do it and possibly for a higher fee or payment. But in general, I would say, yes, a large part of it was them helping us out and their generosity. And so we do appreciate that, because I understand that it's not a lot for a lot of work and a lot of physically demanding work, to be honest.
All right, Chairwoman Finelli.
Thank you, Chairman. Dr. Pointer, do we have any kind of an idea, let's say last year? What was our expenses as far as that was concerned?
Last year was about $115,000 for the year. That's about 500 bodies that needed to be transported to the
That's a
medical
big
examiner's office.
And the previous year, was it around 500 as well?
It's, the number of deaths has increased as our population has increased, and of
Sure.
course, the opioid epidemic has affected that too. So our number of deaths, especially those needing transport to the medical examiner's office, has been increasing, but it's been around there.
All right, so planning into next year, what number would you be planning as far as transports?
That's a great question. I think there's a lot that's unknown. We're hoping that this request for bid is successful.
But in the bid, what are you estimating as far as the amount of transports you're gonna need?
I think we'll need at least the same number, if not more. So I think 500 to 600 transports, you know, would be reasonable and maybe even an underestimate. There is the possibility in the bid that it could be split up amongst more than one bidder or group. So it may not necessarily be one person or one group who's providing those services who has to do all of those 500 or 600.
Where are we with the process of the bid?
It's been written and Law's reviewing it now.
Okay, thank you.
Just before we go on to Legislator Nagustakis, I think that for your budgeting purposes and all that, we won't talk about any proposed new fees for this, in case anybody's.
Oh, yeah,
You know,
that's what I was talking about, numbers. I mean, because they're gonna have to put something.
they're gonna put a number, but then it's also gonna have to relate to a dollar amount too.
Right.
Yeah, and I'm not talking dollar.
No,
I'm just
let's-
talking
I just want to reiterate that, let's not talk about
And
that.
we still have a lot of unknowns. That's why I just wanted to start the conversation now before
Mhm.
we're all hit with it in a month or two.
Thanks for bringing that forward, Legislator Nagustakis.
Thank you again. I'm a little confused because the numbers you've thrown out imply on the 500 or so cases for 115,000, imply a $250.
Oh, I could be
Not
wrong. I think it's
$125.
$250 then. You're right.
So they get paid $250.
$250 for transport. I'm sorry. I misspoke.
I thought it was less, but it could be.
No, you're right. It's $250
Well, the
for
numbers you gave
transport.
would imply 250.
Yeah, you're right.
So that's the correct number.
That's the correct number.
Okay, thank you.
I apologize.
Legislator Amo.
Just clear for me here, when you first were telling us this, you said you were considering either bidding or doing it in-house. But I heard now that you pretty much made the decision, you're gonna try to go with bid. What is it, if it doesn't come in the way you want it, we're gonna revisit the idea of an in-house? eliminated in-house.
Our preference is to go out to bid.
Okay.
If that's unsuccessful, then we would consider ways that we could bring it in.
Okay, fine. That's what I kind of concluded by in there. Thank you.
Yeah, there are still a lot of options on the table.
Okay, thank you.
One other quick question. Quick question. Sure. On average per night, per day, how many bodies come in? If it's 500 on average, it's like 1.5. I mean, is that a fair number?
Yes, sometimes, obviously, if there are bigger issues, we'll have more than one at a
Right.
time. Also, if it's something that occurs at a hospital, the hospital will hold the decedent for us until the following morning. So if it's an unattended death, that's at a home or in a car accident or something like that, then that's more urgent, it has to be picked up immediately. Whereas, like I said, if it's something that occurs at a hospital, we can go the next morning.
Right. So it seems to me if you're gonna bring it in-house, what you're considering is whether, personnel can handle 1 or 2 bodies a day at about being $120,000.
It's challenging. There are lots of physical requirements, as we talked about. So some of our current personnel may not have those physical requirements.
Sure.
And then also the transport issue itself is another thing that we've been considering, because if we had a county vehicle, we would need it to be county employees who drive that vehicle. So lots of factors in play, but I would say, yes, on average, 1 to 2 per 24-hour period.
Good, thank you.
Yeah, I'm sure that our colleagues at personnel compensation will be taking.
We've been working with a lot of other departments. They've been very helpful.
Great.
Yes.
All right, you want to go into your update?
I'm hoping that maybe I won't talk about COVID next month. We'll see how things go. Right now, as I talked about last time, we're tracking things in different ways. So hospitalization rates are low. Our wastewater trend has been decreasing across, I think, all but one of our sites, and the other site has been stable. For vaccines, 40% of our vaccines have a bivalent booster. 13 of our adults over 65 have a bivalent booster, 13% of our total population. Information just came out within the past week that I think 96% of American adults have antibodies. How helpful that is questionable, but that came out recently. We have our ad campaign in malls, and there's a Let's Talk Shots collaboration with pediatricians and Johns Hopkins around vaccines in general, but also around COVID vaccines. I will say that the FDA just endorsed a monovalent vaccine for COVID again against the most common variant, the XBB variant, which is the one that we are seeing in our wastewater locally. So that'll be some information possibly coming out on the horizon if things move in that direction, is going back to this monovalent vaccine, but we'll keep listening and see what happens there.
Still good.
Question on the COVID. The current numbers that we're seeing, I don't remember the terminology, but the current numbers that we're seeing, are they lower than the number that is necessary to continue community spread? Are we under that number of not having community spread anymore?
So that's a complicated question because the CDC isn't looking at community transmission rates anymore, which means they're not looking at people's individual tests. And that is what really gives us the best idea of whether community spread is happening, is the people who aren't going to the hospital, who are getting mild cases, who are maybe spreading it in their families. We don't have that data like we did in the past. However, based on the wastewater trend decreasing, I think we can say that spread is decreasing at least. I know that doesn't completely answer your question, but we know that it's moving in the right direction, and we know that we're seeing less of it being shed.
Thank you.
Thank you.
There was a typo in my next update for pertussis, so it was from January. This was through the end of May. Orange County had 39 reports of pertussis, which is whooping cough. That's 4 more cases since last time I talked to you, which means the rate has slowed, but it is still significantly over our baseline. And we've been working with our providers, our educators, and our communities to encourage vaccination.
Now with that, with the pertussis, whooping cough, do we have records going back with what the rates were prior to your joining the county, or?
We do, and pertussis is something that kind of waxes and wanes over time. So it does tend to cycle in different years. Despite that, we're still higher than our baseline is. And if you look at the county, you know, you can kind of see the county ebbing and flowing. And then you can see certain communities in the county make up a significant portion of that ebb and flow. So you kind of have the county, and then you have these communities that are a significant portion of that. So we're trying to limit spread in those
And
communities.
can you tell what makes it spike?
It's,
What causes it?
so it naturally ebbs and flows, but of course, people who aren't vaccinated are more likely to catch it during those periods and are more likely to increase those curves.
How is it transmitted? Through close contact?
It is usually, yeah. So we see it a lot within families. So grandparents and grandchildren, because a lot of older people, their vaccination has worn off, and very young people maybe haven't gotten the vaccine yet. And then among sibling groups, occasionally in like daycares, but family transmission is common.
Okay, thank you.
In our public health emergency preparedness division was very busy during our smoky air event a couple weeks ago. We worked really closely with the schools, with the chamber, a lot of other county departments, emergency services. We've updated our air quality and smoke plans after that event. It really gave us a chance to kind of solidify what our plans were and our communication strategies. I feel like overall it went pretty well. We're hosting a public health emergency law conference July 17th and 18th. Following COVID, it will be a really good opportunity to recap and have an idea of what we can and can't do in a public health emergency, whatever the cause, and also what we're obligated to do in a public health emergency. So I think that'll be a good opportunity to review what we've learned and also to see how it applies to these other public health emergencies that we're going to face moving forward.
Questions? All right,
And lastly, our environmental health department. So the good news is the county is growing, and a lot of that leads to updated infrastructure. That means that we have unprecedented numbers of plan reviews. We had 497 plan reviews in 2022, which was the highest that we've ever had. And in 2023, we're now on pace for 540 plan reviews this year. That's on our engineering side, and same with our sanitary side. Our housing and nuisance concerns continue to increase, which means that we continue to get more housing and nuisance complaints. It also means that the county is taking on more of those housing and nuisance complaints. So I have just housing complaints here, and you can see the blue line is the number of complaints, the orange is the complaint cases followed up on. The ones that were not followed up on by us tended to be followed up on by the municipalities. So it doesn't mean that they weren't addressed, but they were referred to the municipalities. And you can see that our involvement has increased over time, and the number of concerns has increased over time. In 2023, our involvement is up to 76%, from 70% last year. And that's just for housing concerns and complaints, doesn't take into account some of the other nuisance concerns. So a lot of growth, a lot of opportunities for improvement. Like I said, in that infrastructure, we've really been trying in the environmental health department to provide education. So they've been going out to the libraries and doing education there, working with food tech, education there, even with, building inspectors and municipalities to really try to be preventative as much as we can.
okay. Legislator Amo.
You can finish your report.
Yep,
Sure. I
done.
just have some direction on the question I have, and it may be something we talk offline. As I see the nursing home census dropping down all across the county, all the state, you see it in Orange County, we're down to 60%. the direct admission from the hospital, coming out of the hospital, to nursing homes, they're not taking them in, they're not taking admissions. Is there any breakdown there between the two systems? And is any of it our problem or is it totally the same? I ask that because you can imagine, and know, I can imagine, is that, you know, if you have a person who's responsible for DLG that they're in nursing home, in a hospital, they want to get them out as quickly as possible because they're not getting reimbursed. And so if there's no place to go, we have a crisis. And I don't know if I haven't heard much about that. I wonder, do you know anything about that? Or is it not the county's business? Take that as an example.
So I would say, of course, it's our problem and our concern in some way because it's our residents, right? I know Commissioner Miller talked briefly about the committees on aging. So I'm actually on the long-term care subcommittee, and that is one of the working groups within that subcommittee is talking about exactly what you're talking about, which is from one place to another, from hospital to rehab to nursing home or hospital to nursing home and vice versa, because we know people move in the opposite direction. How do we improve that process, make sure that's done more seamlessly? And we don't have any solutions yet. We just started meeting, I believe, last month or 2 months ago. But it is something that we know that the state's thinking about, and certainly the, you know, this working group is thinking about. But I agree, it's a significant issue because there is a lot of breakdown in communication, in payment, in even residents having options as to where they go, communication with families. There are all kinds of directions we can come at it.
Those of you hear it a lot. You know, the discharge nurse at the hospital, you call the family and say, you know, you got a nursing home. Here's a list of 4. It's up to you. Sometimes, and after you run it, you go to every one of them, and they're not taking admissions. Or there's this problem, that problem. So what happens to that person? Oftentimes it's stuck in limbo. And they are our residents, that's what I'm thinking. They are a concern of ours individually. But if the system is, I just wondered.
Yeah.
Okay, I'll let you, whatever
It
you
is
come
a
back on,
concern.
great to hear.
I'll let you know as I get updated. We actually have a meeting tomorrow.
Sort of a macroscopic issue of this thing, but it's kind of an interesting, for me at least. Thank you.
Yeah.
Okay, everybody good? All right, that clears the agenda here. So I'll take a motion to adjourn. I thank you, Commissioner and Deputy Commissioner.
Thank you.
And can I get a motion?
So move.
Cal? Is that Michael Emo? Okay.
Thank you.
All right, all in favor? Aye.
Hi.